This is Aaron Gettinger with the Arkansas Democrat-Gazette, and I have here as my guest Dr. Joycelyn Elders, who at one point headed the Arkansas Department of Health for Governor Clinton, served as his first Surgeon General in Washington, and has been an outspoken advocate for public health for her entire career. It's a delight. Pleasure is all mine. So I wanted to ask a little bit about your early life, if we could begin with
Sure.
that. Do you have any relationship with Southwest Arkansas today? You grew up in that part of the state, right?
Yeah, my parents lived there until they died, and they were almost 100 when they died.
Wow.
And so we tend to live a long time. That's how I get to renew it, meet all of my nieces and nephews, and I tell everybody I have enough nieces and nephews to supply the world.
Lucky you.
Lucky me.
What was it like joining the Army in 1953? It was so soon after segregation that I would imagine there was
Yes.
still. No, I can't even imagine what that was like. What was it like?
Well, had the opportunity. I was in the Women's Medical Specialist Corps. I joined, and it was during the Korean conflict, and in 1953, and I had graduated from college, and they were trying to recruit young women to be either physical therapists or occupational therapists, a speech therapist, to really provide services in the Army for the people involved in the Korean War. So when you ask me what it was like, we were commissioned as second lieutenants, so we went in as officers.
You were an officer.
I was an officer, and but then I went to school, physical therapy school, for a year. Well, 6 months of being at Brooke Army Medical Center, more didactic kind of work. And then after that, I had the opportunity to go into not Fitzsimmons, but Letterman Army Hospital in San Francisco for my internship, which was really enjoyable. And of course, being when you're a physical therapist, you're taking care of patients. So you're just not a doctor. You're a therapist providing exercise and therapy for soldiers that's been injured. And it was a pleasure. I really enjoyed. I loved being at San Antonio. I loved being in San Francisco, and I really enjoyed being in Denver.
And I was wondering about that because I thought that you did your residency in Minnesota. Why
Yeah,
did you come back to the South after living in the Bay Area, after living in Denver, it was Minneapolis, right?
right. I went to medical school at the University of Arkansas, and so well, I was accepted to medical school at the University of Colorado and also at the University of Arkansas, but I really, Arkansas was home.
Yeah.
And so I guess I just wanted to be here.
And I wonder if you can say anything else about that, because I'm thinking of it in kind of the historical context of the Great Migration and people leaving that area and that kind of thing. But it was home and you wanted to come serve here. That was what motivated it.
I wanted to come out. I don't like to look at myself as someone who really wanted to be of great service and serve. I wanted to be a doctor to provide service, but it was not, general kind of service that you think of. Like some people just grow up with this idea that I wanted to just provide service to my people. I'm afraid I didn't have that. I wanted to become a doctor, but then I wanted to become the very best doctor that I could be. And in order to be that, I felt that I needed to go to the best medical school that I could get into and that I could afford. And I used the GI Bill. I went into service to train to become not to become a physical therapist, but to get into the service. See, I was just going to join the regular Army as a private. And when I went down to the recruitment office that day, there was a colonel down there. She says, And she told me, she said, well, you finished college? And I said, yes. She says, we need people to become a physical therapist or occupational therapist. She gave me said, what would you like to do? And so I thought I would really like to become a physical therapist.
It's interesting that you say I wasn't motivated to serve, and yet your life has been one of a lot of public service. Did
Yeah.
something happen between, 1967 and 1987 that made you interested in shifting gears into, being a public figure and that kind of thing?
Oh, I never really thought of myself as being a public figure. I always thought of myself as I wanted to do the very best job that I could, wherever I could, and for whomever I could. And when you see, you have to know where I started from to know what it means to talk about, even going into the Army. Yeah, I was the oldest of 8 children from Southwest Arkansas that was very, very poor. And so we didn't even have electricity and running water. And we had outdoor privy, so we didn't have any of the things that everybody accepts as totally normal. And so anything I would do is almost a upgrade from working in the cotton patch all day.
How would you compare public issues in Arkansas from the late 80s to now? I'm curious what you did in the state health department that you're proud of, issues that you've seen that have progressed on, issues that have seen regression on. How do you perceive that kind of thing?
When I look and think of public health issues in Arkansas and what's happened, well, I went to the health department because I felt so strongly about the fact that Arkansas had the second highest teenage pregnancy birth rate in the industrialized world. And I wanted to do something about that. And I felt, and I was seeing young girls in my clinics, when I was doctoring, who were pregnant and almost didn't know how they got pregnant, or had been sexually abused, or didn't know one thing about contraceptives, and it was just so depressing to me. And I felt that we wanted to do something about that. And I went in feeling I wanted every child born in America to be a planned, wanted child. And I felt so strongly about that. And that, if you said I had an issue, that was the issue. That was my issue. And I really, and of course, you must have to admit that at that time, or even still, so many of the young girls that was having babies planned, I won't say unwanted, because by the time they're born, they're usually all wanted, but unplanned, let's say, were Black. And I just felt that and I wanted to do something about that. And then I found that it was not just Black girls, it was all over. But I felt we had an unprecedented number in Arkansas. And I really felt strongly about that, and I didn't mind who I jumped into to try, who could help me do something about it.
How do you think about evolving gender relations among Black Arkansans or African Americans more broadly over the course of your professional life or your whole life? I mean, certainly you've seen a lot of change in how men and women relate to each other in the last 90 years.
Yeah, oh yes. I've seen a lot of change in regard to, before, back in the day when I was coming along, as far as I was concerned, there was 2 genders, men and women, We didn't know anything about any other genders. And then, as far as I was concerned, we were concerned there was 2 races, Black and white. We didn't know anybody else. And so we're talking about down in Southwest Arkansas where I was, and so as far as I was concerned, I was really fighting and wanting to make a difference for young African American women. And it was important to me because I felt we could. And I felt that all they needed was an opportunity. And I had seen so many of them in my clinics being wasted because they just didn't know better and there was nobody to help. So I really put on a big fight. I felt we need to have comprehensive health education in schools from kindergarten through 12th grade. And I really fought hard for that. And I think we really got it. We didn't, you can get, just because you get a policy change, don't mean that you get everything else changed. So we got the policy change to say that we were going to have comprehensive health education in schools from kindergarten through 12th grade, but that never happened.
What do you think the role of men is? I mean, do you think that men have approached sexual health or contraception differently than they did
Yes.
in the late 80s? Tell me about that.
Well, I think that before men really felt it was a woman's responsibility, to prevent pregnancy. They felt no responsibility for pregnancy.
Mm-hmm.
And I think that now they're beginning to realize that it takes two.
Just now?
Well, not just now, but that it's changed, but changed quite a lot.
Uh-huh.
But for a long while, and it hadn't been too many years ago, it was the responsibility for a pregnancy was a woman's responsibility. And men had, their responsibility was to be men.
Mm-hmm.
And if their wife or girlfriend got pregnant, if they weren't ready, it was their fault.
When you think about why these changes happen, why do you think they happen? I mean, what were there policies? Were there cultural changes and expectations and that kind of stuff? But what affected this? What do you think affected this?
I think a lot of it was really policy, cultural changes.
Mm-hmm.
Men were really, and our culture was, men were the head of the household, men were the leaders, men made all the decisions, and their wives did what they said do. Well, and I think that's changed.
Mm-hmm.
And I think as women have gotten more education, have been able to really see themselves in a different light, I think, and be more in charge of their bodies. And one of the things I always preached, that if you can't control your body, your reproduction, you can't control your life. And I feel strongly about that. I feel that if you want to have 21 babies, that's fine. I have no problem with that. But I feel you need to want to have 21 babies, not because somebody else said, or because it was because you didn't know better or because you couldn't do better. But if you want to control your life and what you want to do and what you want to be see yourself as a woman, that there's nothing in the world that you can't do.
I wanted to ask a bit about endocrinology,
Yes.
pediatric endocrinology, which was your medical specialty, in terms of, and what you've mentioned already, how the role that specialty plays in transgender care, especially
Yes.
for juveniles. How do you think of it? Why do you think so many more children are identifying as transgender nowadays? And what do you think the medical response and the policy response should be to them?
I think the medical response and the policy response need to change. We've not accepted the problem with transgender, and nobody talked about it. It was kept in the closet. The children didn't talk about, they knew they were different, but they never said anything about it. And I think that it's very important that children be allowed to discuss that and talk about it early. And we as parents need to understand it enough so that we can discuss it with them and accept it and make them realize that, it's all right. You need to be whomever you feel you want to love, whomever you feel you want to be with, that it's all right. that, that I can't decide that. And nobody else should decide that for you.
And I wanted to ask also what you're thinking about those T1DM drums like Ozempic and what they might mean for treatment of juvenile diabetes and that kind of thing, especially given the, instances, racialized outcomes and that kind of
Right.
stuff with this disease. And it seems like it's a revolution in treatment. I'm curious how you're thinking about it.
Well, any new treatment that we can really come up with that really works. Children with juvenile diabetes, whom I took care of for years, need to have some help. They work very hard. I was one of the initial researchers in the insulin pump.
Mm-hmm.
That was a terrible. It was wonderful. It worked. But, can you imagine? I remember a young woman, she told me, she says, Dr. Elders, I always felt that once I took my shot, that I could go out and I felt normal. I felt okay. But with this insulin pump, she said, it keeps my blood sugar better and all that. She said, but it makes me feel like I have diabetes 24 hours a day.
Mm.
And you can imagine, you've got something hooked up to you that's infusing insulin every minute of every day.
Mm-hmm.
That means that of course, you have to be a lot more careful, about worrying about making sure your blood sugar doesn't get too low or something.
But you can't get away from it because
But
it's
you
on
can't
you.
can't get away from it. It's hooked onto you all the time.
Mm-hmm.
And we want better control. We're trying to prevent the long-term complications of diabetes, the eye disease, the neurological disease, the foot, the other kinds of diseases, complications. We won't say diseases, other kinds of complications, but we want to have better control. And we knew we weren't getting great control with giving the shots. Even when we went from one shot a day, when we first got insulin, we thought we was halfway there.
Mm-hmm.
Then we went to 2 shots a day with our juvenile diabetes.
Mm-hmm.
And then we went to the 4 shots a day, or the insulin pumps, which was a continuous infusion. So none of those were good. They were just an improvement over what we had before. And the insulin pumps of the continuous infusions is just not for everybody.
Mm-hmm.
And I never thought of it in terms of, until this young woman, she said, I always felt that I had diabetes and I gave my shot. And I felt I could take my shot and I was normal for the rest of the day. She said, but this way, she said, it makes me feel like I've got diabetes 24 hours a day.
Did you hear that from other diabetes patients?
Yes.
Similar things? It sounds interesting, yeah.
Yeah. Well, but I understand that. Yeah. Now this was with the insulin pumps.
Mm-hmm.
And see, we did some of the initial research on using insulin pumps. And yes, we got far better control of their blood sugars because we know that if we give a shot, we may then we have 400, we may drop down to 40, and we knew that was not good. But by the same token, and we knew we got far better control with the continuous infusion, but it was not great.
How do you think of the rollout of the Affordable Care Act in Arkansas, particularly in light of the Clinton administration's health insurance reform push? Do you think about what might have been had that passed in the early 90s versus now, pros and cons of either of them? I'm just interested in your thoughts about this.
I'm very much in favor of the Affordable Care Act. And I feel that health care should be a right for everybody. I feel that all people, if you're sick, you should have a right. Every criminal has a constitutional right to a lawyer. But we don't feel that every sick baby has a constitutional right to a doctor. And that's America. And I feel that we should We're above that. We can do better than that.
What do you think of Governor Sanders' refusal to expand Medicaid access to young mothers?
I, I feel that Medicaid access should be available to everybody that needs it. And to not expand Medicaid to young mothers, to me, is almost criminal.
Have any recent governors of Arkansas reached out to you for your expertise during the pandemic, for instance, or anything like that?
I felt that Governor Huckabee was a far better governor than I expected him to be. I thought he was going to be a goat, but I really think he turned out to be a pretty good governor. I think Hutchinson, I didn't necessarily like him as a lot when he was a senator from Arkansas, because we fought all the time. Primarily, we were fighting primarily about the right to life, teenage pregnancy, But I felt that he used good sense, and he was a good governor.
How have your views about drug policy changed since you were in Washington? It strikes me that we have drugs that go in and out of popularity,
Yeah.
for lack of a better word. So crack cocaine has declined. I'm curious if you saw the opioid epidemic coming. How do you see that through a public health lens?
Well, I'm very concerned. I was really for legalization of marijuana.
So you think that's a positive development in
I
state by
think that's a
state?
positive development. One of the things about marijuana, I felt that, we say alcohol is legal, but, I feel that marijuana does not do nearly as much damage as alcohol in many respects. In fact, there's some data that just suggests that young people, less than, teenagers, that there may be some damage, long-term damage to the brain, but I'm concerned about that. So but, I feel that for us to have as many young people in prison related to crack cocaine and that kind of, and I'm not suggesting using of crack cocaine, but I'm just saying, but we have more people locked up for marijuana than for almost anything, especially young black males.
I almost asked if you smoked pot, but then I thought, it's illegal in Arkansas. I shouldn't ask for that.
Yeah. Well, no, I've never smoked pot. I've never tried it. But I'm one of the people who really, I feel that I would much rather young people smoke or try pot even than cigarettes.
But I am curious, opioids have just subsumed everything, and they're still here in areas that had never had, methamphetamine kind of presaged it in rural areas, but nothing like this has hit in rural communities before. And I'm wondering what you think about, like harm reduction techniques that are being used to address this epidemic. What would you say, what would you advise policymakers to try to get ourselves out of this situation right now?
I don't really know. I really, if I had, I think they know and you know that if I had a slick solution, I talk so much that I would have already told them what they need to do about it. So I don't know, and I have been very concerned, but I do feel very strongly that a pot should not be illegal. We should not be putting people. We should not be building jailhouses to warehouse young people for smoking pot. That, if we're talking about hard drugs, I feel that we should be trying to get them into treatment. And so that's where I am. I don't feel that we get there by throwing them in prison.
Your time as Surgeon General really coincided with the climax, or almost the ultimate climax, of the AIDS crisis. Did you see the antivirals coming before they got here in 1997? Did you anticipate that some kind of game changer was going to come out? I can't imagine being in the belly of the beast like that when so many more people dying year and year, and then suddenly a game changer comes and people stop dying. But I'm wondering how you were thinking about it when you were in Washington and that kind of thing.
Well, when I was in Washington, obviously, AIDS was everywhere. It was really a big thing. And of course, I was really pushing for sexual health. Let's educate young people. Let's try and prevent them from getting AIDS. Let's teach them, you know, we're sexual beings from the day we're born until the day we die. So let's try and teach them how to be sexually healthy. And so that's what I spent an awful lot of my time
Yeah.
trying to teach young people about educating them about sexual health and to take care of their sexual health as well as their partners. I wanted to prevent, obviously, pregnancy. I wanted them to prevent, disease, and and I wanted them to really be healthy. But I certainly, I always tell. I said, don't ever forget the 3 P's for sex. The first and most important, I said, is for pleasure. The second P is a procreation. We want to procreate, and I think that's important. I said, the third, for prevention. We've got to prevent disease, prevent unplanned pregnancies, prevent things of that sort. So I said, so if I teach them how to take care of themselves, how to be healthy, how to prevent disease, and have babies when you get ready. And as far as I'm concerned, if you have 20, everybody talked about abortion. I was never about abortion. As far as I'm concerned, I've never known any woman to need an abortion that was not already pregnant. So, and then if you're already pregnant, you don't want. If you really want to be pregnant, you don't want an abortion. So that's where I was. So I was about preventing unplanned pregnancies.
And I'm wondering how you think of that then. I mean, we've got tools like the pill, as well as tools like PrEP that are being used right now to prevent HIV. But, the fact is that, PrEP only protects against HIV instead of other sexually transmitted diseases. And I'm curious how you just think about preventing pregnancies and also unwanted pregnancies, but also preventing, sexually transmitted infections, given how many developments have happened in recent years in those areas.
I was on the board of the condom board to make and prevent condoms, and I went around to try and prevent. I was about trying to, condoms. With the use of condoms, you prevent disease and you prevent pregnancies. And about getting young people to use, more to use condoms. And they don't feel as good, and and you're too much pregnant. But I always said, if you get a young girl pregnant, I said that doesn't feel good either. And I say, and young women, I always tell them, I said, just think, if you're talking about going to your junior, senior prom and you're 9 months pregnant, I said, that boy that got you pregnant is not taking you.
Do you think that this is the messaging that should be used?
No.
No?
No.
What do you think the messaging should be?
Well, I think that we need to educate our young people, starting early and being honest. We as old folk have been the most dishonest. We've been silent, and our silence has been deafening. It's cost our young people their lives in terms of disease. It's cost young women in terms of being poor, ignorant, and slaves. And so I'm just saying that we need to educate them on, I want you to have as much sex as you want, but I want you to have healthy sex.
Since your famous 1994 comments about masturbation,
yes,
the amount of available pornography in this world has increased unfathomably because of the internet. And I'm wondering, we have seen policy in Arkansas to, do age verification with online pornography and that kind of thing, but pornography is ultimately tied to masturbation. And we have younger people who are frankly having sex less. We have all these issues of atomization in society and that kind of thing. I'm just curious how you view about, pornography in a public health context, in a cultural context, just given how much that this has changed and how early people are exposed to it, children are exposed to pornography, and how available it is in day-to-day life.
Well, the availability is we can't do much about that. We can, we can have policies and all to control some of it. But let me say that if parents, if we as parents would educate our children about their sexuality, it wouldn't matter what other people said. If they were educated and knew and understood what was going on, they wouldn't be bothered. That would not. But the problem is we have all of our churches. We've said masturbation is a sin. We can't waste the sperm or remember all of that. And so we need to educate our young people, and we need to get away from that kind of thing.
And you think it starts with parents?
Yes. Oh, I think the real problem starts with parents. We don't, that's what I'm saying. If we don't educate our parents, how can we educate our children? You can't educate the children if you haven't educated the parents.
Well, I think it's an uncomfortable conversation to have with your children and that kind of thing, but
it's uncomfortable. But is it more uncomfortable to have your 12-year-old come up and say, I'm pregnant? That would be more uncomfortable to me, as far as I'm concerned, for most parents.
What's your relationship been with President Clinton since 1994?
Well, I think we both respect each other, and we've talked, and he's done a few things for me, like on my birthday, he's done a birthday party kind of things. So I have the utmost respect for President Clinton. I felt that he did what he felt he had to do when he fired me as Surgeon General. I never felt that he wanted, in his heart, wanted to fire me, but I felt that things were going on in Washington was such that he did what he felt he needed to do for the sake of the country.
Do you have a cell phone number or anything like that?
Do I have his cell phone number? No, but
Not
I know.
that close, but yeah.
No, but I know how to get it. Every time I've ever wanted him and needed him, I've called him and I've always got him. Okay.
Did you see something like the COVID pandemic happening? It's even in your 90 years, nothing like the Spanish flu had ever progressed,
Right.
and then it did. And so it's. Someone said one time that it's so interesting to be, she was 71 or something like that, my age, and have something happen that's doesn't remind me of anything else. And so I'm wondering if you saw it coming and how you, after a career in public health, thought about something on that level.
I thought that the COVID pandemic happened because of part our failure in public health, partly because of our ignorance and not knowing, partly because we didn't get our immunizations out as rapidly as we should. Partly because, we have all of our hang-ups about I'm not going to wear a mask and stuff like that. So I think it's been partly our fault, and it's been partly, we had never seen a disease like this. If COVID had probably been as contagious, and it might have been almost, as measles, where we broke out and are really sick. See, I saw lots of measles. I was a doctor and a child during measles. We just felt that if somebody got it, they was going to give it to we just waited until they gave it to everybody else, and we know that if one person with measles, you go into a room with 100 people that probably a certain percentage of them will get measles, a very high percentage. Whereas that's not true. It's not quite that high with COVID.
But you said, had COVID been that contagious, what do you think would have been different?
I think COVID probably should. And the other thing is, we started out with COVID it affecting more old folks.
Mm-hmm.
You know, like old folk get sick with COVID and die, and we expect old folk to get sick with something and die. So, you know, and and then and then we began to realize that it was not only affecting old, poor black people in crowded conditions, but it's affecting many other people. So we
Mm-hmm.
began to really come to real grips with we needed to do something about it. And then, and then it came out that if we really wore masks, get the vaccine, hand wash, the things we know to do, that would help.
So, almost 100 years, over 100 years passed between the Spanish flu and COVID happening. And I'm wondering if you think that there's a potential for a pandemic on that scale to happen within the next 100 years, or something like AIDS happening again. I mean, we've seen two major
Yeah.
pandemics over the course of your life on that scale. I'm wondering what you think of the odds of something like that happening again in the foreseeable future.
You know, I obviously hope that it doesn't happen. We're going to work hard with those of us in public health. We're going to work hard and do everything we can to educate the people to try and rapidly make sure vaccines are available.
Mm-hmm.
But the other thing we're going to try, and we have a better way of educating our people. But we have to have people who, I won't say are educable, but who are willing to listen. Because a lot of people knew about getting the COVID vaccine that didn't get it.
How do you want to be remembered?
Oh, I think what I would want to be remembered that I really did the very best I knew how to make a difference for young people in this country.
Thank you very much for your time, Dr. Elders.
You're very welcome.